Hey everyone, welcome to episode 97 of The Green Life. In today's episode, we're going to talk about women's reproductive health and how important it is to go for our checkups every couple of years or as needed when it comes to cervical screenings, smear tests, and so on. We're going to talk to Dr. Ben Snowden, who is an OBGYN in the UK, and he shares everything he's seen through his practice and training and how important it is for women not to feel intimidated and why. He also is the co-founder of HapiLegs, a company that has created some trousers for making women feel more comfortable when they go for their screenings because they're not so exposed. And we're going to talk about all this and what limits people, especially women, to go to the gynaecologist to get checked up and why this is a barrier that we can get over by using the right equipment and the right dress code, which unfortunately our medical systems don't always provide. If you want to know more about HapiLegs, you can go into the show notes. I've linked everything there. In the meantime, I want to give a big shout out to HapiLegs for sponsoring this episode. I have a discount code for you in the show notes. I've just become an affiliate, so if you buy the trousers from my link, you'll get a discount code and you help the show carry forward. As well as, of course, a big shout out to Namawell, where I don't make money, but I have a discount code for you. So if you want to introduce more raw food and juicing, you can check out their C2 and their J2, which is juicer, and the C2 has got a blender as well as Dr. Morse's herbs, of course, to make sure that you can cleanse your body, help your body perform its best. And I've also linked other companies I collaborate with and I'm an ambassador for, an affiliate with, because I really believe in them and I personally use these products. I've also shared my Ecodharma Village link for retreats as well as my practice, and so you can get in touch with me if you're keen to work together. All right, we're going to dive into this episode. I think is really, really important to talk about our health as women, our reproductive health specifically, and understand what we're talking about when we talk about cervical screenings, smear tests. A lot of people would just don't know because we're not explained. So here it is, a great summary of that and a bit of light shedding on questions that as women we all have. Enjoy and welcome to our guest, Dr. Ben Snowden. Hello, Dr. Snowden. Thank you so much for making the time to be on The Green Life with me today. How are you?
I'm well, thank you. How are you?
I'm okay. Thank you. So excited to talk to you today. It's a very important subject. We're going to talk about women's health, particularly our reproductive health. And I know obviously you're an OBGYN, so I'd love for you to share a little bit more about your career first and how you got into medicine and why you chose this line of business into medicine. And then we take it from there.
I've been a doctor since 2013. I've been in training to be an obstetrician and gynaecologist ever since then. And I finished my training after 7.5 years worth of postgraduate training only recently. So I'm now fully fledged eventually after all that time. And I first became passionate about women's health from about my second year at medical school. I was attracted to it more from the maternity point of view, in helping well women through a particularly risky part of their lives, a quite dynamic and interesting group because you're treating two patients at once, which can be difficult to weigh up the risks involved and also the priorities involved, both aligning ourselves to women's priorities and the maybe somewhat occasionally contravening priorities of that baby as well. And that's a real satisfaction in medicine to be able to help families through that event, both look after their mums and babies all the way through their antenatal period and also that risky intrapartum period, in guiding mums and babies and partners through that and getting a happy outcome at the end, or at least a happy and safe outcome for both. Sometimes we can be misaligned with patients in that our priorities can sometimes not agree. But as a clinician, I've always got to respect that and come to some sort of agreement to try and get both through what is a risky time. It's one of the probably most risky times that people go through. And they're getting a happy and safe outcome for mums and babies at the end.
Wow, that's amazing.
So yeah, it's a real honor to be at that part of women's life, and especially a part of their new family, and helping them through that time. So it is a real honor to be in this field of medicine.
It really is. And I mean, I'm obviously coming from more of a naturopathic background. So it's sometimes I actually find it really nice to see that finally allopathic medicine and naturopathic medicine is kind of starting to work together. Because I know a lot of women, you know, you said sometimes we're not aligned with everything when it comes to our doctors. Mostly because I think a lot of women want to go back to a lot of the more instinctual way that we always gave birth. But there is a benefit of knowing that we have the advances of medicine on our side, because, as you said, when it's risky, we want to make sure that we're safe, our babies are safe. And unfortunately, sometimes we can't do that all natural.
Yeah.
We have to have the support.
No, and I agree that childbirth is a wholly natural event, and left well alone, for most instances, will go just fine without any intervention. But the segment of women that I deal with who need assistance in labor or have a high-risk baby on board may need intervention. And I'm always happy to discuss that intervention, because we've moved away from that paternal form of medicine. It's no longer acceptable to state my opinion as an obstetrician and say this is what's going to happen. That's not fair, and it's not the way that we should be being in partnership with our patients, because it's an honor for us to be involved in that, and to get a good outcome, then we have to be fully aligned with each other and state our potential, our disagreements, and come to some sort of agreement, or at least a way forwards between ourselves, so that we can get to that outcome. And it's not just solely, yes, I got to the end of your pregnancy and your labor and we delivered a baby safely. That is just a very small aspect of the whole journey of the antenatal period of being pregnant, and labor and childbirth, and also that postnatal period and bonding. Because if a woman and a family have been through a terrible antenatal period or a traumatic labor, then that sets them off on a pathway that may not be what they want to be.
Yeah, very good point. Thank you for that. Now, before, obviously you are working with a very specific segment of women, but before pregnancy, before even getting to the stage of wanting to have a family, there are many arrays of reproductive health that we can explore. And I think one of the things, obviously, you being involved with a company called HapiLegs, which focuses on allowing women to feel more comfortable going for smear tests and making sure that they are healthy even before they consider having a baby. I would love you to talk to me about first of all, a lot of women don't actually know what smear test stands for. So maybe we can share what that is exactly, so they understand, and then also how important it is when we start doing it, and how often we should check and so on.
So smear tests is an older term. So it's purely we take a small brushing of the cells of the cervix. So that's the neck of the womb that's at the top of the vagina. Those cells are somewhat like the cells on the inside of the mouth. They slough off really easily with resistance. So what you're able to do is take a small sample of those without doing any damage, and literally smear them on a microscope slide, was what we formerly used to do. Have a look at those under the microscope and see whether there are any changes compared to what we know were normal cells. Now we've moved slightly away from that, certainly in the UK, from a formal smear test to what's called cervical screening. So we do the screening test in the same way. So a screening test should be for those women who are asymptomatic and are purely coming for a test that we know may predict that disease may occur, and that any treatment that or advice that we can give at that time may prevent disease from occurring or pick up disease at an earlier stage so it can be treated with more ease. So what we search for now when we're doing a cervical screening is something called high-risk HPV. So that's human papillomavirus. And there are two subtypes, HPV 16 and 18, which cause about 70% of cervical cancers. So what we're doing is picking up ladies who are carrying HPV without any symptoms, and we're looking to see whether they have those present. And if they do, we then go forwards and have a look at a formal smear. So have a look to see whether there are any changes to the cervix itself. And if there are, suggest either follow-up, which is more frequent than the normal smear program, or whether they would be offered treatment in the form of colposcopy, which is where we have a look at the cervix in a more formal way under a microscope whilst the woman is awake. And stain up the cervix to see whether there's any changes. Currently in the UK, we invite women for their first cervical screening at the age of 25, and subsequently they have it every 3 years up until the age of 60, and then they subsequently have it every 5 years.
Okay.
But we find that if we're able to pick up high-risk HPV and either monitor that or treat it, we're preventing from disease occurring or more severe disease occurring.
And those diseases include cancer, right?
Yeah, so cervical cancer is the main aim of prevention with the cervical screening program.
Okay. My question now is, you mentioned people are invited from 25 years old upwards, but we know that and we know HPV is part of one of the viruses that is sexually transmitted. And
Yeah.
a lot of girls are starting to have intercourse a lot earlier in their life now. We have seen also their cycle starting earlier. It used to be around 12, 13. Now a lot of girls earlier than that are starting to bleed. There's obviously a lot of hormonal changes because of our lifestyle, what we're exposed to. And I'm just wondering if this invitation age will be updated at some point. Do we wonder and worry that a younger population is at risk, and you can go over 10 years without monitoring with a cervical test? How do we decide when it's time, given the changes in our population, I guess, lifestyle?
Yeah, so having high-risk HPV present until there are changes within the cervix can take a number of years, up into about 7 years. So we know there is a lag from the first infection with HPV until you're going to get changes. So that's one of the reasons why the cervical screening program starts slightly later. I think we've found that if we would screen women earlier from the age of 20, which is what we formerly used to do in the UK, that we were picking up quite a lot of ladies who had false positives. So we thought they had changes. We then took them and had colposcopy. We may have done treatments to them and then found that those treatments were either inadequate or unnecessary. On your point that obviously the kind of population is changing and that girls are starting to menstruate and have sexual intercourse earlier, we do know that early first sexual intercourse is a risk for HPV. The more sexual partners that you have is also a risk for high-risk HPV, and the subsequent changes to either CIN 1, 2, 3 and upwards into cervical cancer. We do now offer, and I know in a number of countries across the world, we offer vaccination against HPV, and we offer that to both boys and girls in the UK at the age of 12 to 13, which should hopefully, as we now see that those children now maturing into the cervical screening program, I'm hoping that the first signs that we've had is that a lot of women who have now reached that age are carrying less amounts of the expected high-risk HPV due to vaccination programs.
And for people that don't want to take the vaccine, because obviously it does come with some risks and with everything, what is the option? What is the best approach to educate the younger population about being safer?
So HPV is obviously sexually transmitted. It can be sexually transmitted in a number of different ways, and that's not just penetrative intercourse. Barrier methods may go away, such as condoms or the female condom to preventing high-risk HPV. I feel as an obstetrician and gynecologist that vaccination is one of those methods that we can do, but if you're not wishing to take vaccination, then safe sexual practices would be the way that I would suggest that, and also attending for screening when your invite is given.
Yeah, and do you feel like there is enough sexual education in school? And I know we're starting really early with this conversation because obviously when we talk about cervical screening, we want to make sure that it's something that is ongoing. But do you feel like children are, and I want to call them children because they really are, so it's really crazy to think that they're having sex, isn't it? But children are educated enough? Is something that, are they educated about what even a cervical screening will be when they have to go? I haven't really been exposed to that.
Not that I'm aware of, but I think it's something that women tend to find out through older women, and it's kind of fed down and drip fed. I don't think that young girls at schools are told about cervical screening or informed about what it will be and what it will entail, and it's not a pleasant thing to have done, and nor is it something that you would wish to have done. But I suppose we need to inform girls that it will be something that is offered and the importance of that, and also the importance of safe sexual practices.
So when it comes to going for our screenings, then we are invited. It's not compulsory. However, I mean, I lived in the UK, so I know the NHS is it's actually one of the best systems I've encountered, especially being something free. Well, paid by taxpayers, of course, but free as in you don't have to pay for your screening test. You can go to your GP locally and see your nurse. And I had a very lucky experience, very good with my doctors, with the nurses. But I know that there are women that will avoid going for these screenings because, again, you mentioned having HPV, or even if you don't have HPV and there are changes, this can happen without HPV. But people are afraid and they like, well, I don't have any symptoms, so until I need to worry, I won't worry. What's your opinion on this approach, and how can we actually educate women and making them feel more comfortable to come and see you or their nurse and doctors to actually check periodically so they are sure that everything is fine? Because as you said, there is a lag. There is a time where, things happen slowly, thankfully, but prevention is better than cure. So what do we do for women that are, until I'm sick, I won't do anything about it?
So I would encourage women to take that mindset that it's like checking your car over before you break down, and it's like maintenance essentially, that we're checking the cervix, we're having a look, we're seeing whether there are any changes, because those changes before you're sick, when you are sick and there are symptoms, that could be something way more serious, and something that you would rather avoid. I would encourage women and those with cervixes who go for screening that they're the person who's in control. And I say this to all of my women when I examine them, that they're in control, and if they want to stop at any point, then they can do. There's a number of strategies, and I've suggested women who are uncomfortable with having intimate examinations that they tell the clinician that they're seeing, and that just to actually verbalize that they are anxious, and that to keep that in mind when we're examining a patient. There are certain strategies like inserting the speculum yourself, which may be helpful. It's all well and good saying relax. That's something extremely difficult to do. But I would encourage women that they are the person who's in control, and that clinician is there at your consent. And if you withdraw that consent, that then has to stop. I think that is the mainstay, and that's the change that I hope has happened through medicine, from that paternalistic kind of viewpoint that we used to have to a more collaborative relationship with patients.
Yeah. You mentioned actually a subset of women who don't want to go for tests, who are anxious and afraid and feel exposed and vulnerable. And I'd like to talk about this in relations to HapiLegs. So sorry, yes, go ahead.
Sorry, we found that when we've spoken to women, and I as a clinician have seen this, that cervical screening and intimate examinations in gynecology seem to be misaligned with other ones, such as urological examinations, where men or women are examined. They have, when I went for urology examinations, that you just drop your trousers a little bit, but you remain largely covered. We saw other examinations such as colonoscopy. There's now an offering of some small shorts that you can wear with an access flap at the back to allow for examination. But women were getting an unequal deal, that they were asked to undress from the waist down and then get onto a bed with either some very poor sheeting or lots of exposure, with the potential for quite an unequal amount of dignity that is lost with that. There's the chance of getting cold, for one. There's a chance of that sheet dropping, which I've seen many occasions. There's also, even though it seems very simple, there's a lot of misunderstanding, and you notice that the sheets, they're on top of the sheet instead of underneath it. Whereas we found that offering ladies a more comparable offer of dignity and an actual coverage, because I don't need to accidentally touch a lady's inner leg, a woman to feel anxious that she may have not shaved a leg, she may have not shaved a pubic hair. That is none of my interest, but I know it can be a real barrier for women who are attending. There's no reason for me to see the rest of this lady's legs, and we found that there was nothing on the market to try and give women that reassurance and dignity. And hopefully, I'm not saying that HapiLegs will reduce all anxiety for cervical screening, because it won't. But I'm hoping that everywhere we look, and all the research that we've done and the research that's out there across the world on looking into barriers for attendance to cervical screening, embarrassment is always mentioned. Embarrassment and pain and a bit of misinformation is probably one of the greatest comments that come up again and again when patients are surveyed to see why they don't attend. And I find that if a patient is exposed, then they obviously become anxious. There's a certain amount of tension in the pelvic floor that goes along with that. And then when placing a speculum or inserting a speculum, then it is uncomfortable. And that then transpires to the procedure being painful, it's uncomfortable. And then the next time that you're invited, you may not want to go because that first experience was uncomfortable and painful.
Totally.
So if I'm able to prevent that from occurring, and these are a really small, cheap way of giving ladies that control and that dignity of saying, yes, I'm ready now, because of the way that the device works, that it's patient controlled. There's no clinician involvement. Once a patient's ready and is in that right space, then they're able to open up the flaps that are on the front of the trouser, and only the area that I need to see and need to work, put a speculum into, is exposed. There's no additional areas of exposure. The patient is able to be warm. They're able to walk around and get off the table. And there's no risk of dropping, and there's no risk of me starting before the patient's ready.
Actually, I think we need to step back a little bit and talk about what HapiLegs are, because obviously you and I are aware, but many people might not be aware of what they are. They're a relatively new product. So can you just explain what HapiLegs are?
So HapiLegs are a piece of PPE, essentially. So they're worn by patients. They're a pair of trousers that come in multiple sizes, that are from a single-use material that is recyclable within common waste streams within most healthcare systems. The fabric that we use is in common use across most kind of theatre settings. And what the trousers are designed to do is allow women to both get up and down from the examination table, but they have a series of folds in them with ties that are able to, when they're opened up, expose a small aperture within the pelvis, within the crotch area, so that a lady can be examined through that area. So they can either have a cervical screening test, or they can have sexual health screening tests, or they can even have colposcopy performed whilst wearing these trousers. We've also had use of them with insertion of coils. There is outpatient management of miscarriage that we've used it for. But our primary aim was to help increase cervical screening rates and to give women that power back.
Okay, brilliant. Thank you. When it comes to statistics, what have you seen in terms of women not going for their cervical screenings? And also, what are the percentages of women that can or have incurred cervical cancer as a result of not going for screening?
So the last question I don't have answers to, unfortunately. We're currently we've had the trousers into studies to see how patients feel about them and how clinicians feel. But what we're looking to currently is they are going into trials in primary care, so that's general practice in the UK, to see whether more widespread clinicians are happy with them and whether it does increase uptake of cervical screening. And we would be able to extrapolate from that for non-attendance. If we're able to reduce non-attendance rate, how many cancers subsequently we would be able to reduce. We feel that non-attendance can be up to 50% in certain parts of the UK, certainly in central parts of London, and in parts of the UK where there's more ethnic minorities. We find that uptake for cervical screening is also impacted in those areas, and we can find that is, and that's one of the barriers that we've seen, that within certain religious communities, that exposure is a real no-no, despite it being for medical reasons, and that exposure can be seen as undignified and dishonorable, in fact. So these are one of the reasons that our products have been created. And we did work with some Muslim communities, and one of our designers was a Muslim woman every lady that we speak to seems to say that this would be a brilliant thing to help safeguard me and enable me to go for my cervical screening.
Yeah, absolutely. And this is something that actually I think is really important you bring up. I am, in most countries, like say right now I'm in Portugal, and the majority of the population are Portuguese and European, and there is a cultural openness to going to see a doctor. Now, this is independently from a person having anxiety about it and not going because of that. But as a culture, they're very welcoming to going to see their gynecologist and having tests, and they completely are aware of what happens. But it's true that in a country like the UK, where we have a lot of different backgrounds and minorities, which are ties to religious beliefs, can be a little bit challenging because they are now obviously feeling like they're compromising their status as religious followers when they have to go through some medical procedures and or screenings. And that is such a good point. So I'm really glad that you brought it up, and also that you worked with women in the communities to make sure that other women in their communities are aware of this and can feel more comfortable and also less judged and exposed and against their beliefs. So yeah, that's very, very important point to make. But is the HapiLegs concept is wonderful, and I think this is something that I really fully embrace and endorse for many reasons. I personally don't have a problem going to have my screening, but I did have an episode with a OBGYN, a woman actually, which, again, a lot of people are like, well, but if you go to a woman, you should feel more comfortable. I don't find that, personally, I don't find that that's necessarily the case. In this case, it wasn't for me. I normally have a wonderful OBGYN in Porto, and I couldn't see her, and I just wanted to just do a screening. And I had a very bad experience with a woman at the local private hospital where, yeah, they gave me a gown, which is obviously open in the front. So, yes, it's a little bit better than not having anything or just a sheet, but it wasn't very, comfortable. And also, she made me feel very uncomfortable per se. Like, you're sitting there and at her mercy, being almost judged,
Mm.
So it was, and I am not, as I said, I'm not somebody that is actually uncomfortable with going for screenings. Like for me, medical procedures and diagnostics are wonderful ways to know what's going on with your health. I'm very open to them. But in this case, I really felt it. And I just, in that moment, I really thought, wow, if I had the trousers on, maybe I would have felt a little more empowered to even say, 1 second, I just need a moment, instead of being exposed, like open already, to her basically controlling everything that was going on down there. So I find that this should be something that is in every single hospital for us women, even if it's not something that is given to all women, just as an option. Do you want
Yeah.
this? Would you feel better? So how's it going in the UK? Because I know obviously this is right now a private project and a private product that women can purchase on the HapiLegs website. But how are conversations happening with the NHS to try and embody them into the system? Do you know what's going on with that?
So we've currently had trials within the NHS, and feedback that we've had was almost completely wonderful. There was some, we tried it on a number of procedures, and there was some it really didn't work for. Hysteroscopy it turned into quite a wet mess, unfortunately. So, because it's a fluid using procedure, and HapiLegs weren't designed for that. But both from a clinician point of view and a patient point of view, the feedback was wonderful. And I think what we need now is we're looking to further studies in a larger population, so that we can acquire that data to say to the NHS, look, this is how we've improved screening take up, and consequently this is how many cancers we could have prevented by this. And that's one outcome. But there's all those non-measurable outcomes, such as dignity and comfort for women, and I think that's something we may not be able to ever manage or measure. Sorry, but it's something that hopefully we can improve. And just giving that that patient that control to be able to say, I'm not quite ready yet, doctor. It's just give me a few moments. And although the procedure's never going to be wonderful, but the least traumatic and the least uncomfortable I can make it, the better for both me as a clinician and the patient, both for her comfort and also for future times that that lady is able to come back and say, yes, I had my cervical screening. It wasn't great, but I had these safeguards in place and I felt as comfortable as I could.
Do you feel like that the new generation of doctors, like you're pretty young, are more aware, open, and inclined to actually respecting the feelings, not just the anatomy of their patients versus the older generation of OBGYNs?
I feel so. I feel there is a certain generation that have either retired or due to retire that were taught in a different way than we were. And I feel that this new generation of doctors that are coming through are highly more respectful of that relationship between a patient and clinician, and that it is a more collaborative relationship that we have to respect that relationship, and that if we are doing and taking into account those huge patient that whole patient side and that patient opinion upon how they want to manage their own condition and their own health, then I have to respect that and work with them rather than pushing my opinion and what I feel should happen onto them.
Yeah. And when it comes to sharing this information, obviously another thing that can come through is people can feel like, obviously there's a lot of fear mongering when it comes to healthcare, unfortunately, mostly because I think the old system of allopathic medicine is always like the doctor knows best and we don't want to educate the patients, but actually now hopefully that's changing. At least I see it with our naturopathic approach. We want to educate and empower our patients because, we want them to be able to make decisions that are consensual, but also where they actually look at evidence and learn how to look at studies if they feel like they want to, or ask questions. And this is not something that is always welcome in the allopathic setting. But when it comes to educating women about coming to smear test or cervical screenings, fear mongering is something that I personally don't feel works and actually can put people off a lot more than we would want them to. I see that even with nutrition, like the more you want to push people to change the diet out of fearing to get sick, just doesn't work.
No.
We need to inspire them to wanting to do it. How do you share the information about the importance of screening, but also, the opportunity, the option to buy HapiLegs and invest in that so that they can feel more comfortable if they really don't feel comfortable about going for the screening?
So the HapiLegs website does have a few blogs on it I've done myself. Some of them informing women about the actual terminology and what screening is and what we're looking for. I'm really happy when a patient comes to me saying, I've looked at this research. I learned I'm always happy to learn from patients, and especially if they've looked deeply into a certain method of treatment, then I'm really happy to go away and learn from that. Doctor comes from the Greek for teacher, so it should be that relationship that me with my learning and my knowledge should be helping to impart that knowledge onto others and say, these are your options. This is what I think's going on. These are what the options are for you. You can take this one. You can take this one. And this is your disease to manage. It's not my disease. This is yours, and you need to take ownership for that. And I need to empower you to make those choices about your lifestyle, your disease, and what treatment you wish to take. And I agree, fear-mongering, you can fear-monger all you like, and looking at it as a reflection, looking at smoking, that we say, oh, look, this is what it can cause. There are plenty of smokers who see all of those warnings and yet carry on smoking.
Yeah. I mean, the packets of cigarettes are scary to look at, and they still do it. So, yeah, I know. Okay, brilliant. So now talking about HapiLegs as an option for women is not available yet as a free option in the NHS or anywhere else. But where can women get it? How can they get access to these pens?
So they can buy them from the HapiLegs website. They are single use currently, so you can dispose of those at your GP surgery, just into the normal healthcare waste systems. If you wish to, you can take them home and reuse them, but they are designed to be single use. We are really hoping that this will be something that will become more of a normality within public healthcare systems across the world. And they're inexpensive, and we hope to be able to say that this very small investment will help encourage the uptake of screening, and therefore help prevent cancers from either occurring or help them to prevent appearing at a later stage. And also, as I said, just to give women that actual control back.
Can I just, before we close, there's a subset of women, obviously there's a higher risk age group between 20, well, it used to be 20, but that's just to 20 for the sake of it, 20 and 55, I believe. What happens after that age? What is the recommended screening for women that are in menopause, but maybe they're still sexually active?
So we reduce the screening. We reduce the screening down to 5 yearly, between 50 and 65, and then we feel that the likelihood of changes onwards from there, from 65 onwards, we would continue to invite ladies if their smears were abnormal towards the end of that period. But onwards, we wouldn't do cervical screening per se. If we felt that there was an issue with the cervix, that we would send directly to colposcopy for that microscopic examination of the cervix rather than the screening program itself.
Okay, brilliant. That's good to know, because a lot of the women that are on my podcast and in my circles are, perimenopausal, menopausal. But I know also that there is, a generation of women that are looking after themselves a lot. And then perhaps if they are not longer married, are getting into new relationships later. And obviously we want to make sure that they are aware of their sexual health still being a priority even later on in the years. And obviously we work a lot with the hormones, which is very, very important. And I really believe that actually our cervical health as well as our uterus is really related to hormones as well. So that balance is important. Screening is very important to me. As I said, I think, the advances of medicine have made it so great for us not to just guess, but know. And I think we should take advantage of what is available and do it in a wise way, collaborating with our GPs and our doctors, our medical providers. And I'm glad to see that and as you mentioned, the generation that is studying with you and working with you and specializing with you is much more open to that collaborative approach to medicine. Because I think us patients, and we all are patients at some point, I guess, need it. We want to feel empowered by the medical system and not disempowered and scared. So thank you for sharing everything, and thank you for the work that you do, and thank you for getting involved with the project that I think is really wonderful and has a lot of avenues for helping women. I even thought this is such a great product for, sexual abuse victims, because when there's a lot of trauma that goes into something like rape, and then, getting obviously examined to see if by the doctor to see if there is any evidence of semen so that they can find the culprit. I think it's really important to know that there are ways to minimize the add-on trauma that comes after events like that. So I think HapiLegs has a future in many avenues, not just the diagnostics and the prevention part of sexual health. So thanks for that.
Thank you. No, we hope so too. We're not in this to we're in this solely to make change. That's what we're here to do, and to hopefully prevent disease and to give women that power back.
I think something we should probably mention at the beginning before we close is you obviously, your wife is the co-founder with her dad and you of HapiLegs, and this was something personal to her. She was the one that came up with the idea, right?
Yeah, I'd love to say it was my idea, but it wasn't. My wife, it's her idea, and having had screening and attended for screening always, that she saw that there were potential barriers to that screening, and as we wanted to make a change, whether that be through information to begin with, and then we found that there was nothing to help women have more dignity. And we saw again and again when we were looking through that these barriers to attendance, that embarrassment was always mentioned.
Yeah.
And that we'd found that there was no equality between male health and female health. And we saw the likenesses to colonoscopy, and there was just nothing for female health. And that's the disappointing, more paternal and more male-orientated system of medicine that we've inherited. But we're hoping to make some stepwise change towards that equality.
Yeah, brilliant. Well, thank you so much for being on The Green Life today. Thank you for sharing. Thank you for explaining. I will link everything in the show notes so people can go to the HapiLegs website, can purchase the pants if they feel called, but even if they just want to learn about it, share it. This would be such a great resource for a lot of women, especially younger ones that feel intimidated, or older ones that are really not, thinking that this is something that they should do, but they really should look into. So I think for all of us women, this is really important. And thank you again for mentioning that there's a system in place that needs to shift. I think generally, universally, we just see a shift between this patriarchal society into a more women-led, in a positive way, that is more attentive and more nurturing. And I really think we need that in primary health care. So thank you. And as it was an honor having you on, a pleasure talking to you. And hopefully you'll be back soon on The Green Life for more, advanced information about what's going on with HapiLegs and also what you see in the healthcare system. We always want to know and learn more from you.
Thank you. Thank you very much, Chantal.
Anytime. Take care.
Thank you so much, Dr. Snowden, for taking the time and for sharing. And guys, thank you so much for being on the show. I hope this was helpful for us ladies. Please make sure that you get familiar with all the names of cervical screenings and pap smear and what they do and how you should take care of your health preventatively so that you don't have to worry about facing bigger issues at some point. Also, check out HapiLegs. If you're someone that is struggling with anxiety to go for your OBGYN checkups, this is something that you can use to have more control, to feel empowered. I'm also very glad that Dr. Snowden has shared that he feels that the collaboration with patients is very, very important. We're moving away from a system that didn't take us into consideration, and I think that's really, really key so that we can trust our medical field better and we can actually be healthier. All right, guys, I hope you enjoyed this episode. If you do, you know what to do. Share it, rate it, make sure that you give us feedback, help us grow so we can have more and more amazing guests on the show. And I'll see you next week. Bye.